to meeting number 26 of the Standing Committee on Public Accounts. The committee is meeting in public today and it is being televised. Pursuant to Standing Order 1083G, the committee is meeting today to study Report 8, Pandemic Preparedness, Surveillance, and Border Control Measures of the 2021 Report 6 to 9 of the Auditor General of Canada. Members, I'd like to take the last 10 minutes of the meeting today to discuss some committee business. I believe the clerk has sent you the relevant information for that portion of our meeting. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021, and therefore members may be attending in person in the room and remotely using the Zoom application. Madam Clerk, I would just have you confirm that
there's no one in the room. Yes, sorry about that.
No, thank you very much. So for all of you who are participating virtually, interpretation services are available for this meeting. You do have the choice at the bottom of your screen of either Floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. When you are done speaking, please put your mic on mute to minimize any interference. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of headsets with a boom microphone is mandatory for everyone participating remotely. And as you know, should any technical challenges arise, please do advise me. And note that we may need to spend for a few minutes as we need to ensure that all members are able to participate fully. I'd now like to welcome our witnesses this morning. Joining us today from the Office of the Auditor General are Karen Hogan, Auditor General of Canada, Carol McCullough, Principal, Chantal Richard, Principal, Sarah McDermott, Director, and Francis Michaud, Director. From the Canada Border Services Agency, we have John Osowski, President, and Dennis Vinette, Vice President, Travelers Branch. And from the Public Health Agency of Canada, Ian Stewart, President, and Cindy Evans, Vice President, Emergency Management Branch. With that, welcome all, and I will turn the floor over to Ms. Hogan for 5 minutes. Ms. Hogan.
Madame la Présidente, merci de nous...
Madam Chair, thank you for giving us this opportunity to discuss our audit report on pandemic preparedness, surveillance and border control measures. I am accompanied today by Carol McCullough and Chantal Richard, the principals responsible for this audit, and also by the two directors, Francis Michaud and Sarah McDermott. This audit focused on whether the Public Health Agency of Canada was ready to respond to a pandemic. And the audit also focused on the agency's actions in the early stages of the COVID-19 pandemic. We also examined whether the Public Health Agency of Canada and the Canada Border Services Agency had implemented and enforced border control and also mandatory quarantine measures to limit the spread of COVID-19 in Canada. Overall, we found that the Public Health Agency of Canada was not as well prepared as it could have been to respond to a pandemic. I am discouraged that the agency did not resolve issues that in some cases were raised repeatedly for more than 20 years. Since the last major health crisis in Canada in 2009, the agency had worked with its provincial and territorial partners to develop plans and guidance to support a coordinated national response. However, not all emergency and response plans were up to date and, more importantly, the federal, provincial, territorial response plan had not been tested before the pandemic broke out. Early warning is key to limiting the introduction and spread of an infectious disease. We found that the agency's two main early warning tools, namely the Global Public Health Intelligence Network and the agency's risk assessment process, did not work as intended. When cases of an unknown pneumonia were first reported in China, the network did not issue an alert to domestic and international public health officials, contrary to its own criteria.
The agency used a risk assessment tool that was untested and not designed to assess the potential impact of the introduction and spread of COVID-19 in Canada. The agency continued to assess this risk as low despite growing COVID-19 case numbers in Canada and around the world, until the Chief Public Health Officer of Canada requested a change to the risk level in mid-March 2020. We also found that the agency had not addressed long-standing issues, including with the information technology infrastructure it uses to conduct health surveillance activities. For example, the agency had not finalized an agreement to share health data with its provincial and territorial partners. These issues impeded the exchange of health data between the agency and provinces and territories and had an impact on the agency's ability to form a consistent and timely picture of COVID-19 infections in Canada. Despite these problems, as the pandemic progressed, the agency quickly and continually adjusted its response to trigger public health measures and slow the spread of the virus. When discretionary travel was prohibited and mandatory quarantine was imposed on incoming travelers, the Canada Border Services Agency reacted quickly to implement public health measures at all air, land, and marine ports of entry into Canada. The Public Health Agency of Canada and the Canada Border Services Agency work together to implement border restrictions and communicate quarantine requirements to incoming travelers. However, the Public Health Agency of Canada had not contemplated or planned for quarantine on a nationwide scale, including following up on travelers identified to be at risk of non-compliance. As a result, the agency had to develop enforcement capacity in real time. We found that the agency did not know whether 2/3 of incoming travelers had complied with quarantine requirements. Therefore, the agency could not gauge the effectiveness of the mandatory quarantine in place to limit the spread of COVID-19. Our report includes 8 recommendations, and the 2 agencies agreed with all of them. Madam Chair, this concludes my opening statement. We would be pleased to answer any questions the committee may have. Thank you.
Thank you very much, Ms. Hogan. We will now go to Mr. Osowski for 5 minutes.
Bonjour, Madame la Présidente et membres de commission.
Good morning, and members of the Public Accounts Standing Committee. I am happy to be with you to answer questions on the findings from the Auditor General on the execution of control measures at the border during the pandemic. I'm here with Denis Vinette, who's Vice President of the Travellers Branch.
Madam Chair.
Mr. Longfield, I think I know what you're going to say.
We have the English and French at the same volume level on the English translation. If that could be fixed, that would be great. Thanks.
Shall I continue?
Madam Clerk, what would be the remedy for that?
Okay. And I'll let you know in a moment.
I can continue in English if that's okay.
No, it's important to get the translation right. Thank you.
So, Mr. Osowski, are you now on the floor and will be speaking in English?
I'm English and I've got the English channel selected for
We should
myself.
be fine.
Yes. Okay. So I want to
you.
thank the Auditor General for her report and say that we accept the recommendations to ensure that the border service officers have the appropriate guidance and tools to enforce border control measures and to conduct a review of decisions related to essential service providers to ensure that exemptions are properly applied. The Canada Border Service Agency border service officers have been at the front of this pandemic since January 2020, when enhanced screening measures were first implemented. In addition to the 90 acts and regulations that they normally apply, they've also been responsible for implementing the provisions of over 45 pandemic-related orders in council. These provisions apply to different categories of persons presenting at our ports of entry, such as essential service providers and citizens. They are designed to restrict travel and reduce the spread of the virus. It's important to note that these provisions, which are revised regularly to reflect the changing pandemic conditions, add several layers of complexity to the decision-making process. Every day, CBSA officers make over 35,000 decisions regarding entry. Each decision reflects an individual's unique circumstance and is based on several factors, including the OAC provisions, to determine whether a person is permitted to enter Canada and what their quarantine obligations are. Our officers exercise their professional judgment in a highly complex environment and are well supported in their training to apply these measures. I want to emphasize that our officers have neither the discretion nor the authority to overcome the obligations and requirements as prescribed in the orders in council. They cannot exempt travelers from quarantine based on any business-related or compassionate factor. That said, given the complexities they face while making these decisions, there may have been isolated incidents of misinterpretation that resulted in incorrect decisions. In such cases, we have strategies to continually learn and improve. The CBSA also continues to support other government departments and initiatives. We have been supporting the implementation of pre-arrival testing, the mandatory digital submission of contact and quarantine information with the ArriveCAN application, which has now been downloaded over 1.4 million times. These contributions have helped the government monitor and control the spread of travel-related COVID-19. In response to the Auditor General's recommendations, the CBSA has developed a management response and action plan and has already taken steps to address the findings. To ensure that our officers have a sound understanding of new border measures, the CBSA has significantly expanded the provision of detailed technical briefings before new or amended OACs are implemented. Our objectives are to support how new measures are applied to ensure clarity for frontline staff and consistency of application. The CBSA has also established a process to monitor decisions made by CBSA officers on the application of the OACs for essential service providers, and adjustments will be made as required. We are also developing a new training tool to better assist frontline officers in understanding the complexities of the orders in council. Madam Chair, the CBSA is committed to enforcing border measures to minimize the spread of COVID-19 and its variants while facilitating the continued flow of essential goods, including food and medical supplies. Nous avons été à la vente.
We have been at the forefront of this pandemic since the beginning. I am proud of the work that the CBSA officers have done and are continuing to do to protect Canada and the Canadian economy during this pandemic.
I am so sorry. Are you finished your
Yes,
statement,
I am.
Mr. Oslowski?
I am.
Okay.
Thank you.
Thank you. We will now go on to Mr. Stewart for 5 minutes.
Okay, thank you very much. Thank you, Mr. Chair, for the invitation to discuss the Auditor General's performance audit of pandemic preparedness and response. Foremost, we'd like to thank the Auditor General for the work of her and her team. We're pleased that she recognized the efforts of the public service to mobilize, adapt, and respond to the COVID-19 pandemic. Our top priority, as you can imagine, is supporting Canada's response to the COVID-19 pandemic. And we are committed to incorporating the lessons learned to prepare to better our actions now and to prepare for future pandemics. The Public Health Agency of Canada accepts all of the recommendations from the Auditor General's report, and we are already organizing ourselves to respond to those recommendations. A formal and detailed action plan has been developed, and will be implemented within 2 years of the pandemic ending. We're making progress on implementing the plan, but it may take longer than it would under normal circumstances, as many of the people involved in activities with the pandemic are, of course, the people who also need to turn their attention to the remedies, to the report's recommendations. The Auditor General's report covered the period of January 1, 2020 to June 30th, 2020. Since June 2020, of course, the pandemic has continued, and in fact, we're in a third wave right now, which is very serious. So we have taken further actions in some of the areas touched on by the OAG, and therefore some of these things help inform our response to the recommendations. With respect to, for instance, the recommendations on public health data and information sharing across Canadian jurisdictions, in October 2020, the Public Health Agency implemented a national COVID-19 public health data portal. This supports COVID-19 data collection, sharing, and management. We're also working with federal, provincial, and territorial partners on a pan-Canadian health data strategy. On the early detection of public health events, an independent review of the Global Public Health Intelligence Network, GPHIN as the acronym is known, is currently underway to ensure that it meets today's public health needs, but also looking at its role in global and domestic public health surveillance going forward. We expect a final report and recommendations from this independent review later this spring. The advice and guidance from the Auditor General, as well as the work of this review, will inform our way forward in this area. With respect to COVID-19 border measures, the Public Health Agency and the Canada Border Services Agency work very closely together, hand in glove. CBSA expanded its support for frontline border services officers beyond their existing operational guideline bulletins with 24/7 live support and regular case reviews. CBSA also supports the Quarantine Act emergency order and council measures by conducting detailed technical briefings prior to their implementation to ensure they're well done. CBSA also monitors emergency order related decisions by border services officers and is developing a training tool to help the border services officers implement the orders in council. Finally, related to COVID-19 mandatory quarantine administration, in November 2020, PHAC transitioned to mandatory submission of contact information and quarantine plans via the ArriveCAN mobile app and website. This has significantly improved the collection of traveler information and has also supported the verification of compliance with the mandatory requirements. PHAC's response to the pandemic, therefore, has evolved and been informed at each step by what is the evidence available, the science, the epidemiology, the expert opinions, and these can and do change as information and knowledge about the virus and how best to fight it becomes available. There are and will continue to be lessons for PHAC. These are lessons we learn through discussions like this. These are lessons we learn from watching how others are dealing with the pandemic. We continue to learn and adjust our approach as we work to respond to this and future global health events. Along with other audits, evaluations, and lessons learned from the response, we are looking forward to continuing to improve the work of PHAC. So thank you for the time.
Thank you very much, Mr. Stewart. We will now move into our first round of questioning. It's a 6-minute round, and we are starting with Mr. Weber, I believe.
That's right, Madam Chair. Thank you. And thank you to everyone for being here today. To the Auditor General, in your opening remarks, you seem to suggest that the Public Health Agency is slow, mismanaged, fails to respond to audits, etc. Would you say that the root cause is poor management or a lack of funding resources?
So our audit looked at many aspects of how the Public Health Agency of Canada would be prepared or should be prepared for a pandemic. And we did identify that many longstanding issues had gone unaddressed. In some instances, I think the most important one would probably be health surveillance information and finalizing an agreement with the provincial and territorial partners. That had been a matter that we had raised back in 1999, in 2002, and again in 2008 during audits. There was even lessons learned that the department had identified. And I think what it underscores is that all too often we don't place a lot of importance on being prepared. And I think the current pandemic has hopefully made everyone realize that we need to take time to invest in IT tools that support important aspects of preparedness and response for health crisis. And we need to act on known issues. This isn't the first audit where we've seen known issues that go unaddressed. And I do think that across the entire federal government, it's time to place some importance on sort of those things we do behind the scenes that no one really sees, but really make a difference when we're in the middle of a crisis.
Yes, absolutely, Ms. Hogan. Regarding the Global Public Health Network, and of course it was shut down by the current government, even though it was considered a world leader in their work. So who made that decision, and how much does the government stand to save by doing so?
I guess in order to understand the Global Public Health Intelligence Network, I would highlight that it does two things. It issues alerts and it issues daily reports. So a daily report was issued at the end of December that contained links to an article about a virus that would eventually become known as the virus causing COVID-19. And that did trigger a response within the Public Health Agency of Canada. However, an alert, which I think is very different from a daily report, an alert is something that gives you sort of that makes you pause, that makes you stop what you're doing, go investigate and decide what response is needed, wasn't issued. The criteria within the agency would have required that an alert be issued in this instance. It's unclear why one didn't get issued. We saw it issued in the past. What we did see is that in 2018, there were some changes to operating procedures within the agency about who would approve the issuance of an alert from analysts to senior managers. And it appears that that caused some confusion about when an alert should be issued, if it should be issued. We did note throughout the audit that alerts were issued for other matters. So I think it's up to the agency now to decide really what the Global Public Intelligence Network is needed for, make it clear, and then use it as intended.
Great. So again, who made that decision to shut it down then at that time?
Unfortunately, I think that's a question you'll have to ask the deputy minister of the agency. I just know that the approval rating changed and we saw a substantial decline in the issuances of alerts. And it's important because an alert is not just a domestic issuance, it's also an international issuance, right? So I think the agency would be best placed to answer that.
Yeah. Did Canada consult at all with the World Health Organization or our allies about shutting down the Giffen network?
Again, a great question for the agency. What we saw during our audit was that the World Health Organization and our international counterparts had not been alerted that there was a change in the operating procedures that would impact the amount of alerts that would be issued.
Okay. And to continue on here, the network has now been restarted, I take it, and is the system fully functional now? And does it have a larger or smaller budget than it did back in 2016?
Again, those are all things that would be post our audit. My apologies. I don't know if I would even categorize it as stopped and restarted. I would categorize it as its expectations changed when it wasn't clear to us during our audit why an alert had not been issued. So these are all excellent questions that I would hope that the agency could respond.
Yeah. Ms. Hogan, do you plan on doing an audit here on GFIN here in the near future?
I think I believe in making sure that we go where there isn't already evidence. So I am going to wait to see what this independent report on the Global Public Intelligence Network comes out with. And we will monitor the actions taken by the agency in response to our recommendations. That's a commitment I have made, that we will do some more follow-up work. And then we'll see whether or not it warrants us returning.
Okay. Madam Chair, I must be close.
I think
the
you
end.
have about 45 seconds
45
left.
seconds, okay.
Yes.
Now, I'm just trying to see here, any comments from any of the witnesses on any of these questions here with regard to PHAC and the information there? I take it not. Okay. All right, Madam Chair, I'll pass on my time here then to the next.
Thank you very much, Mr. Weber. We will now go on to Mr. Blois for 6 minutes.
Thank you, Madam Chair, and thank you to the witnesses for their testimony here today and for their continued work. Ms. Hogan, I'll just start with you around health surveillance information. For someone that would be sitting at home watching this, in layman's terms, as quickly as you can, what exactly does that entail in your mind from the work that you had done?
So health surveillance information is about sharing data around infectious cases. So it would be the age, the ethnicity of the individual, and a key factor being symptoms when they were identified. It helps enable, I guess, tracing, and also to understand the potential of spread. And so it's key information that the Public Health Agency does need on a nationwide basis when we're in the middle of a pandemic or at the beginning of a pandemic, in order to adjust its response across the country.
And Mr. Stewart, as the Deputy Minister for PHAC, how is that information generally disseminated? Because it's clear from me, or at least as what the Auditor General has said, that we have a bit of a legacy issue in this country, or maybe perhaps around our constitutionality, where there doesn't seem to be an easy transfer of information between the federal government and the provinces as it relates to healthcare. So how generally is that information, this health surveillance information, shared?
Well, a lot of the information is gathered and made public by the provinces and territories themselves in their reporting. We do have data sharing agreements and relationships. For instance, right now during the vaccine rollout, they're providing us weekly updates on the coverage of different populations that they're vaccinating and so on. But as you just said quite insightfully, it is an area of federal provincial jurisdiction. And so these arrangements are arrived at collaboratively.
Ms. Hogan, you mentioned in your report about the federal, provincial, and territorial public health response plan, and it was illustrated in Exhibit 8.2 of your report, that essentially part of the plan was that there would be actual rehearsals or practices of how this plan would play out in real life that didn't happen. Can you speak to whether or not it's clear at this point whether or not, I guess it's clear the practice didn't happen. Do we know whether or not the contents of the actual report were generally met in response to this pandemic? So yes, we know there wasn't an actual plan, a practice, but in theory, when the game actually happened, how well did we meet our plan? Or is that going to be part of a subsequent audit that you may take on?
So you're accurate in your description that a testing of the plan hadn't happened. It was identified as being critical and needing to occur. They were in the agency was in the planning stages of just of having a rather comprehensive test. And I guess I just want to highlight why a test is important. Some people might think that that's kind of silly to have a plan and test it, but it allows you to identify whether or not roles and responsibilities are clear, whether there are gaps in resources or in expectations, and where you might have obstacles that you're going to have to overcome in the event of an emergency. What we saw at the beginning of the pandemic, recognizing that our audit only went to the end of June, so it hasn't extended beyond that time frame, we did see that it informed the response. So one of the elements of the plan was to create a special committee that included the Chief Public Health Officer of Canada and her provincial counterparts, and we saw that committee coming together and meeting and discussing. So the plan was almost live tested, I guess, and it would be up to the Public Health Agency, as it committed to do a lessons learned, to inform whether or not it was effective and what were the gaps and obstacles and how to fix it going forward.
One of the parts of the report, and this is for Mr. Stewart, that I found a little bit interesting, perhaps troubling, was 8.82, 8.83, which talked about the pandemic risk assessment, and that the reports that were being tabled basically from June to March were really looking at the status quo in Canada at the time, and perhaps not looking at the global context of what was moving forward. Mr. Stewart, can you speak to a little bit about why that was the case, and perhaps whether or not that did lead to some of our measures at the border in terms of how we were actually responding to this?
I think it was a learning process the way you're describing. I think our original assessments, which are well documented and which the Auditor General speaks about, I think it would be fair to characterize that it took the severity of the situation to manifest, and then we responded to that. And one of the ways, as you're pointing out, that we responded was beginning to establish a series of border measures in response to what was happening externally. That was a kind of a process of ramping up, which has continued unto this day, as per my opening remarks. I mean, we've added more and more border measures, as you know. So it was a response to what was happening externally, and as the Auditor General points out, there was delay, I think, in recognizing the needs to put those measures in place.
I have about 35 seconds left. As an Atlantic MP sitting in Nova Scotia, of course, we have 4 international airports in this country where PHAC has testing that goes on. There has been questions in my province about whether or not there would be a 5th established to support the Atlantic provinces. I don't know whether or not that's been discussed. Can you talk about why those 4 international airports and perhaps the lack of coverage in Atlantic Canada?
That's an excellent question. So just to be quick, the original focus was just on volumes and the organizational resources required to stand up the kinds of measures we're doing, like testing and so on. I think there's a live and ongoing discussion around what happens next. Certainly, Stanfield Airport's an important airport and does take a lot of international flights. So that would be one of the ones that would be in the next, I think, layer of the onion, as it were.
Thank you very much.
Thank you very much, Mr. Blois. We will move on to Mr. Blanchette-Joncan for 6 minutes.
Merci, Madame la Présidente.
Thank you, Madam Chair, and welcome to the witnesses today. I've got a first question for Ms. Hogan. Welcome to be amongst us once again. We seem to be seeing each other at least twice a week. So turning to your report, from what I've observed, it seems that in the report from the 25th of March, I would say that the report that we're looking at today is the most concerning and the most devastating. You've seen that there have been important shortcomings in the distribution and the transmission and the analysis of risks amongst PHAC vis-a-vis Quebec and the different provinces and our partners. And you've talked about issues about infrastructure, IT infrastructure specifically. So my question is, over and above all of these lamentable failures, and in your opening comments, you've said that this has been ongoing for 20 years, this lack of preparedness. Do you think that we've got a bigger problem in the federal level at the moment? For example, your needs within the OAG, and then there's the Phoenix payment system. So can we say that there's negligence and a laxist attitude in the federal government at the moment when it comes to maintaining the IT systems? It would seem that we're not in a preventive mode. We wait for the disaster to happen and then we react. Is that what you're observing? Well, your question raises a cause for concern for us. It seems we're all in reactive, responsive mode rather than preventive mode. Of course, it's better to prevent than to cure, as we say. And that's the expression that comes to mind now. I think we're always focusing on an emergency situation. And of course, we're all very good, even in the federal government, about getting through things, being able to get through our work with the tools that are available to us. But I think that we have to be better prepared, better equipped, also in terms of the tools available to us. In our office and throughout the federal government, in fact, we see that there's a decision being taken to support individuals rather than investing in systems. But with good systems, efficiency comes through well-trained, intelligent individuals. And we need to have a system that's ready to support them with data analyses. So that's a problem that we see throughout the government and not just within PHAC. But for the moment, we're studying this specific report, and there are shortcomings there as well. Thank you, Ms. Hogan. You've taken the words out of my mouth. It's better to prevent than to cure. And when you're governing, you have to actually look ahead and have forward planning. It seems that we're waiting for a disaster to explode, and then we react. Now, you also talked about this question of transmission of data from PHAC to partners, and also with the GFIN, where Canada was a reference country for decades. So would that suggest then that there's a cause and effect here? There's some back and forwards between the former government, this government. There were reductions in investments, there was muzzling of scientists, there was a reduction in research, and reduced their independent and strategic role. So we're seeing the effects of this now, according to your report. In our report, we didn't really look at it from this angle. We looked at the HR angle in the agency, but you've referenced GFIN, and I think that the issue with the network was a question of confusion. It wasn't clear when an alert should have been sent out. That's why I'd like to encourage the agency to decide well on the objectives of this network and have very clear guidelines and train individuals up and use it as it was meant to be used. Of course, it's easy to have clear guidelines, but if you don't follow them, well, that can be problematic. So I'd like to encourage the PHAC looking at the GFIN, because it plays an important international and domestic role. So we have to shoulder correctly these two responsibilities for the country. Thank you, Ms. Hogan. And then when you talk about clear guidelines, now I'm turning to Mr. Stewart. Have there been recommendations from PHAC to the government to completely ban non-essential travel abroad?
The Public Health Agency of Canada has not been the source of a recommendation of that nature, to my knowledge. A lot of advice has been generated on various ways to respond to the border, but we can come back to that issue if that's helpful to you.
Thank you very much, Mr. Blanchet-Jonca. We will now move on to Mr. Bacharach for 6 minutes.
Thank you, Madam Chair, and thank you to our witnesses. Good to see you again, Ms. Hogan, and thank you to Mr. Stewart and Mr. Osowski for being with us and answering our questions today. I must say that reading over your report, Ms. Hogan, I felt a fair degree of alarm that this could have happened under such serious circumstances. And I was trying to think of a metaphor or an analogy that could help Canadians understand the main findings of your report, particularly around the risk assessment. It seemed to me that in a way, Canada had installed a fire alarm system and our house had filled with smoke, and yet the fire alarm didn't go off. And then in mid-March, the public health officer for Canada had to go in and manually pull the alarm. Is that a fair characterization? I just want people, without having to dive into the detail of the report, to be able to understand the key failure that you've characterized.
I like your analogy. I think I've used it before, that an alert is like a fire alarm. An alert is meant to make you stop what you're doing and go investigate and decide what action is needed. If you're standing outside your home looking at the fire, it doesn't really matter if your smoke detector is going off on the inside. And so I think when it comes to risk assessments, I would look at two things. I would look at the alert system having to trigger a different response or create a sense of heightened awareness. But then there is also, once the daily report identified this virus that was of concern, then the agency had risk assessment tools that it needed to use in order to help predict what the impact of the virus would be. And this is where we saw the tool being not the appropriate tool being used. It wasn't considering the risk of a pandemic. And what you can imagine is that you can look at when a virus is here, what is the risk of it spreading? But in a pandemic, you also need to look at what is the risk of a virus coming to Canada and then the risk of it spreading. So it really needs to have that forward-looking projection that was not there. So again, just like your smoke detector, that warning to make you stop and go look and see what you need to do. So in our instance, the two alert systems didn't work as intended, was the findings of our audit.
Thank you, Ms. Hogan. Turning to the Global Public Health Intelligence Network, in your report, paragraph 8.76 reads, we found that no alert from GFIN was issued to provide early warning of the virus. According to the agency's criteria, an alert is to be issued for an unusual event that has the potential for serious impact or spread. However, no alert was issued when news of an unknown pneumonia was first reported, when the virus had spread outside of China, or when domestic cases were first suspected and confirmed. Public Health Agency of Canada officials confirmed that by the end of December 2019, other international sources had already shared news of the virus, and therefore it was unnecessary to issue an alert. Perhaps to Mr. Stewart, how did your agency determine that COVID-19 didn't warrant an alert?
So on December 30th, an event was reported through the GFIN system, as we're talking about here. The GFIN system succeeded in identifying the event, and then it was communicated out. As the Auditor General has mentioned in her comments, the notification of an event goes out through two pathways. It goes out through a daily report, which goes to the Public Health Agency and domestic parties. And then there's an alert, which goes to a broader international audience. The daily report went out and notified about this event of concern. And as you noted, or has been noted here, Mr. Chair, the Chief Public Health Officer acted upon that and spoke to provincial public health officers, for instance, as a result. The international alert, as the Auditor General mentioned, did not get issued.
Mr. Stewart, would an alert have prompted a different response if it had been issued?
Not within the Public Health Agency of Canada, nor within the Government of Canada per se, because the daily alert resulted in the Chief Public Health Officer acting.
So, Ms. Hogan, if I understand Mr. Stewart correctly, he's saying in terms of our domestic response, there was no need for an alert, that there was the daily report was adequate to trigger the domestic response. Is that consistent with your findings?
I think what I would highlight when it comes to alerts is that alerts were meant to also alert our international counterparts, and the fact that we didn't issue one might have changed, if we had done that, maybe we would have changed the response internationally, which may have changed the response or the need to respond in Canada. I agree that the Chief Public Health Officer, following the daily report issued at the end of December, and her knowledge of what was going on around the world, did alert her provincial counterparts, and it did trigger some response in Canada. But I think no one will really know whether or not an alert would have caused a global change in the response, right? And that's why I think we have a system that's in place that has issued alerts in the past for H1N1 and for SARS. We saw alerts being issued for other events during the COVID pandemic. And so it really does need to be clarified when it should be issued, why, and what the expected response is once an alert is issued.
Thank you very much, Ms. Hogan. We will now go to our second round of questioning, which is 5 minutes, starting with Mr. Berthold.
Merci beaucoup, Madame la
Thank you, Madam Chair. Ms. Hogan, the choice of words is always important in your reports. What incited you to say that you were discouraged because you knew that that term would have quite an impact? So to what extent were you discouraged, which meant that you were obliged to express it like that? Because that is a very strong message that you've sent out with that choice of term. So to use the term discouraged was my personal decision to describe the situation. I am discouraged about the fact that there are issues, long-standing issues that have not been addressed. And the agency was not just aware of this once we've been informed about that by the office surrounding other health crises. So it's discouraging that they didn't react. We wait until an emergency arises before we actually respond. So I have chosen this term hoping that this will bring about a change in the approach in order to be well prepared for another public health crisis. Thank you. Now, Mr. Stewart, the fact that the Auditor General has used the term discouraged, well, how did you receive this? How did you react to this? I think you've just really been wrapped over the knuckles.
It's a call to service and a call to action. I think the work of the Auditor General is invaluable in identifying areas where we could make improvements. And her report is actually very helpful in that regard. In a number of areas where I agree, we need to do more. You know, if I talk about words that I use personally, I used a call to duty. I was actually doing a different job, was asked to come and do this job, and I came to it because it's a pandemic, and it was a call to action. And I'm pleased and honored to be here. And like the Auditor General, I believe we can do more, and we will do more.
Comment, Monsieur Stewart?
Mr. Stewart, how can you explain the fact that the launching of alert system didn't actually work? You earlier referred to the Chief Public Health Officer. So what's the link between the policy and the Chief Public Health Officer and PHAC? Who was actually at fault?
The distinction that I'm trying to introduce, which I think the Auditor General did first actually in her comments, is that there is an internal system that says something's happening, and that's the daily report. And I get them myself every day, as every other public health official and our related agencies in the government do. And they tell us something's happening, pay attention to this. And we have them every day occurring different places in the world, Ebola right now in Africa and so on.
And who is responsible to read it and to interpret it and to call to action after that? Because this is the main problem we had.
That's right. So actually with us here today is Cindy Evans. She's the Vice President of Emergency Management. And so we set up a Health Portfolio Operations Center. We set up a team around a response. And Teresa plays a big role in leading us as our Chief Public Health Officer on that guidance. And she herself, as mentioned in the GFIN story, in the analysis of GFIN, she herself reached out to the provincial Chief Public Health Officers. So there is an integrated system through which notifications get triggered, and that organizes a response. And it's the emergency management group under Cindy that looks after organizing that response.
I know that everyone in your agency have in heart the well-being of each and every Canadian. I don't doubt that. But we have to have a better system to prepare for the next. Just wait a minute. Mr. Ronald St. John, who was responsible for the public health agency before, said, I'm left wondering what kind of event would merit a level 4 activation. I can't believe that a global pandemic with millions of deaths, variants, and on will not merit continuous level 4. I think he is talking about a level of security. Why is not? What does it take to elevate the level and to be prepared? And we don't perceive it right now.
Yes.
A very short answer, Mr. Stewart. I'm sorry.
Okay, well, I wanted to say there is a set of criteria and a system through which event acceleration, escalation occurs, like you're referring to, sir. And in the case of GFIN, as the Auditor General has noted, it happened slower than it ought to have happened. And so part of our work going forward is revisiting the system and ensuring, and the Auditor General again has mentioned, that the people who are running it are trained and understand the processes and are applying them. So
But
thank you for the question.
we're still not
Thank
at level
you.
4.
Thank you very much. I will now be moving on to Ms. Yip for 5 minutes.
Thank you to all the witnesses for coming and answering questions on this important report. My first question is to Ms. Hogan. Regarding recommendation 8.65 states that PHAC should finalize the improvements to its formation technology infrastructure to facilitate the collection of timely, accurate, and complete surveillance information from provinces and territories, both during and after the COVID-19 pandemic. The agency should establish timelines for the completion of these improvements. How serious are these problems related to the agency's IT infrastructure? Does this situation require a major overhaul, or can this be accomplished with smaller modifications?
So in the paragraph that you're referencing, what we were recommending was about improving the IT infrastructure around the gathering and assessment of health surveillance data, an item that had been flagged for many years as having some issues in the agency. What we saw throughout the audit was that the data that comes from the provinces comes in inconsistent formats, and in some instances incompatible formats, and we saw that there needed to be cutting and pasting of information, or it was difficult and it needed to be converted in order to meet the requirements of the system that was being used at the agency. We also saw that the IT system lacked some of the capacity in order to handle the volume they were expecting to receive about health data throughout this crisis. And so it's about making sure that you have clear understanding with provincial and territorial counterparts about what data and how you're going to share that data together, and then making sure that the system has the capacity to treat it all. So it wasn't about the more broader systems within the agency, but really about the one linked to the health surveillance. I do think it's a key and essential component in formulating the response to a pandemic, especially one like COVID-19 that evolves and changes so much throughout the past year.
Yeah, I think it's very important to be able to collect the data accurately and quickly. Do you feel that there's enough resources there?
I believe we saw them throughout the audit, responding and trying to adjust. Ultimately, the question about whether they have enough resources, whether it be monetary or human, in order to deal with a change in an IT system is one better asked to the Deputy Minister of the agency.
In terms of timeliness, do you feel that this is something that needs to be urgently looked at?
Well, I think it's essential, a part of being prepared better. And so, if anything, what we've learned is the importance and value of being better prepared for a crisis, whether it be a health crisis, whether it be a major weather catastrophe that then has impacts on individuals. I think that you just need to be better prepared, and having the tools to better support you is essential. And so, it should be part of the whole lessons learned session that the agency is going to do, and then acted on in a timely way. These are issues that have been raised as far back as 1999, and so it really is time to put the manpower and the money to fix it, so that the next crisis we're not in reactive mode, but that we're a little bit ahead of the game.
Well, thanks for answering the 20-year-old decades problem. Moving on to Mr. Stewart. After undergoing the audit from the OAG, what is PHAC doing differently in this third wave compared to the first and second wave?
in a way, we're trying to evolve strands of activity that started from us. For us, the pandemic is a continuous process. As the virus and the behavior of the variants of concern of the virus evolve, it poses new challenges for us. So I'll give you an example, Mr. Chair. If you think about the initial establishment of quarantine, we subsequently went on to add testing before you arrive at the border, and then testing when you arrive, and then the government approved accommodations to hold people till we have their test results, and then we established day 10 testing because the variants of concern were suggesting perhaps more infectious arriving travelers, and we needed to better know what was coming into the country. And so you see it's an evolution of response in relation to the severity of what was happening within the pandemic. So we're trying to learn from various sources, like the Auditor General's report, like the independent review of GFIN, for instance, and many other comments and questions and studies. And we're trying to evolve how we're doing what we're doing in real time as the pandemic evolves. Hopefully that answered your question, member.
Thank you. How much time do I have left?
I'm sorry, Ms. Yip, your time is up. We've gone a bit over time. I know
Thank
it
you,
goes
Madam
very
Chair.
quickly.
It does.
Thank you. We will now move on to our next round of questioning. 2.5 minutes, starting with Mr. Blanchette-Joquin.
Merci, Madame la Présidente.
Thank you, Madam Chair. I've got a question to put to Mr. Stewart. So the OIG's report is quite devastating, and you've taken actions to correct the situation, which is to be expected. But I do remember, well, I don't know if you've actually asked for your IT budget to be increased. Perhaps it's a bit late now. The impact is already out there, but we need to be preventive. So have you put figures on your needs, and have you detailed your action plan in monetary terms and also in terms of allocation of resources to avoid the situation ever arising in the future?
Thank you, Madam Chair, for the question from the member. We have actually done, as you're suggesting, investments in this area. We created, for instance, a chief data officer and a vice president for information, and also created a team around better organizing how we work with the provinces and territories on data. And so to your point, yes, we have begun to increase resources in this area. And secondly, through the fiscal and economic snapshot in the fall, we did get additional resources to help us do these kinds of actions. To your question, sir.
Merci des précisions, Mr. Stewart.
Thank you very much. Now, agency was considered as a lead agency in terms of the prevention and risk analysis throughout the world, but that's not the case, and this has actually tarnished your image. To what extent do you shoulder personal responsibility in what's been concluded by the Auditor General, and how are you going to reclaim your noble position in the world?
Well, that's a daunting question, Madam Chair. Thank you for that. First of all, I'm accountable for all things that occur within the agency under my authorities, and so yes, I do take accountability in that regard. Secondly, it is an area where I believe we have to be a leader, as you say, and based on the recommendations and advice of the Auditor General, we will be helped in better organizing how we do this function. I'm looking forward to a renewal of our activities in this area, and we have plans in place to do so. I have with me the Vice President who leads in this area as well, if we have any detailed questions. Sorry.
I'm sorry, our time is up. I will hopefully we'll get some more answers throughout this this testimony today. I will now move on to Mr. Bachrach for 2.5 minutes.
Thank you, Madam Chair. I'd like to dive into paragraph 8.82 of the Auditor General's report. This deals with the 24-hour rapid risk assessments, and it reads, the agency prepared a series of 24-hour rapid risk assessments using a methodology that was in a pilot phase of implementation and had not yet been formally evaluated or approved. Furthermore, the assessments were designed to assess the risk of a disease outbreak at a specific point in time and were meant to trigger more thorough risk assessments. We found that the methodology was not designed to assess the likelihood of the pandemic risk posed by a disease like COVID-19 and the potential impact were it to be introduced to Canada. My question to Mr. Stewart, even if PHAC was using COVID to test drive a new methodology, why didn't your agency also follow its established procedure? I guess what it seems like is happening is that is essentially you're test driving a new methodology, but you have nothing to compare it to know if the new methodology is actually producing accurate results. How did you know that the new methodology was going to provide the required thoroughness if you didn't have that comparable?
The pandemic has presented us with challenges and strains at each step of the way for which we weren't necessarily having something that responded to that specific instance. And so we experimented. And in this instance, this is staff trying to find a tool that will help us deal with the challenge of the moment. You know, as we make our way through this pandemic, we'll find things that worked well for us and then things that did not. And so experimentation sometimes doesn't result in the best outcome. So in this instance, people were using a tool to try and deal with a situation at a moment in time. And we learned from that.
Did you get your experiment wrong, Mr. Stewart?
You know, in the instance of each of the moments where we try something to respond to a situation, we're going to have things that work and things that don't work. In this specific instance, you know, I think we can take stock of that as part of what the Auditor General is advising us to do and make an assessment about how to do it better next time.
Thank you very much. Your time is up, Mr. Bachrach. I know 2.5 minutes goes quickly. The next round of questions, 5 minutes. Mr. Lawrence.
Thank you very much. And I'm going to follow up on my colleague's questioning there. I would first of all just read the paragraph right under 882, because it's 88.3 or 83. The Auditor General says 5 rapid risk assessments were prepared from January to mid-March 2020 to inform the public health response. All except the last risk assessment, which was prepared on March 16th, provided an overall ranking that the assessed the impact of the virus as low. Because the assessments did not consider a forward-looking pandemic risk. Mr. Stewart, do you think those earlier assessments were flawed?
Well, I think the Auditor General has identified a key consideration that was not part of the risk assessment, and I think therefore it impacted the overall rating result. Obviously, the future directions that the pandemic can be projected to be moving into is going to be a key consideration for the risk it poses, and that's part of the area where we're going to have to be improving our tools.
But even looking at a static review and not a prospective review, which as a warning system it should, at the time on March 12th, there were 148 cases in Canada, 1,500 in the United States, 3,000 in Germany, 4,000 in France, 15,000 cases in Italy, 1,000 deaths in Italy. How could we have not changed the assessment?
So I'm going to have to turn to my colleague, the Vice President, who does that group's work, because she's going to be closer to the question you're asking, if that's acceptable, Madam Chair.
Yes.
Thank you for the question. And as the President Stewart has referenced, certainly the risk assessments would be done at a point in time. And our systems were triggered in Canada immediately following our alert of the pneumonia cases in Wuhan, China. So what that meant was the system was ready and alerted to and watching for cases coming into Canada. That being said, the risk assessments at those points in time would have looked at the cases around the world and what that meant on the ground for individual risk to Canadians and its transmission. And so certainly those cases would have been taken into account and reflected in the risk assessment results. Thank you.
Looking retroactively, I don't think there can be any doubt that there was a mistake, and in fact, the Auditor General calls that out. Can I ask who in your department has been suspended, fired, or felt any consequences because of the failure to react?
Well, I guess what I would say is we'll have to go back and look for that. I can't answer that question off the top of my head. We'll investigate. You're asking, in effect, the question was the test did not, the risk assessment did not work. In retrospect, it's seen that it underestimated the risk available. And so what have been the consequences for those who took the assessment? Your question's noted, sir.
I thank you for that and would look forward to be reporting back. Who made the final call on what the risk assessment was? Was that the Minister of Health?
No, that would be a staff assessment. That would be within my responsibilities, not the minister.
Okay, one last line of questioning for you. With respect to the pandemic, do you know when the pandemic is going to end?
There's many different ways to answer that, and I'm not quite sure what you're looking at.
The answer is you probably don't, and I'll be fair to there. and because you're putting 2 years plus the end of the pandemic. And, we have variants going on right now, and we need to get these things fixed now. And I understand, and, as a parliamentarian, I'm willing to argue for more resources for you. But we cannot wait for 2 years plus a pandemic to get these issues fixed.
Okay, I understand your question, sir. Madam Chair, thank you for the question. The people who are doing the work are the people who are also doing the response to the Auditor General. There is no division of teams. One of the challenges of being audited by the Auditor General in real time, where we are in this moment of time, is that my staff are working immense amounts of overtime. They're under great stress. There's a lot of, in our public service employee survey, you can see the impact of the strain the organization is under. And so when the Auditor General brings forward a plan of this nature, we talk to the Auditor General about having a management response and how we'll bring that forward. What we're suggesting here is that we recognize that right now in the third wave, in the middle of the vaccine rollout, it's a very difficult time for us to stop the line work and focus on working on the systems. Now, that being said, we're trying to set out, sir, very specific things we can do and will do and are doing. But on the when would be the time that we'll achieve it by, we're just asking for your understanding that it's very difficult to set a specific point in time. Frankly, the numbers have been deteriorating in some provinces, not improving. And so the strain on the organization is quite large right now. And so with some time, we will be able to come back and make sure that we have addressed these things. And I'd be very happy to come back and report on progress at any time in the year.
Thank you very much, Mr. Lawrence. I will now move on to Mr. Longfield for 5 minutes.
Thank you, Madam Chair, and thank you again to the witnesses, including the Auditor General. Mr. Stewart, I want to expand on a few of the comments you've made around the value of these audits. I mean, this is an interim audit. As you just said, we're still in the middle of a very serious situation with the third wave, more serious in my province in Ontario than other provinces. But there has been an increase in capacity within your department of about 1,000 or so employees being added to help with the enormous amount of work that needs to be done in real time. Could you maybe comment briefly on the expanded duties that these 1,000 people that have been added to your department are doing?
Thank you very much for the question, Madam Chair. There's several main sets of kind of activity. If you go back in time a year and a half ago, we did not have a vaccine rollout machine under Major General Fortin. It just didn't exist. There was a small group who knew a lot about vaccines, who understood the vaccine manufacturing industry and who understood the value of different vaccines and so on. But of course, those were focused on traditional vaccines, not these new COVID ones. And we did not have the ability to purchase, transport from other countries, distribute nationally, work with the provinces on their implementation, do the IT systems and all these things. So of that 1,000 people, there is a significant proportion who are just a whole new function the organization didn't have. The same is true with quarantine. as people have pointed out, as the Auditor General has pointed out, we had a relatively modest complement of people who provided advice to my colleague John Osowski and Denis Vinet. And they were responsive, providing advice to the Border Services officers. Now we have several hundred people involved in ensuring that people arriving in the country are tested and quarantined, and that if we find they're positive, genetically sequenced to make sure we know whether or not they have a vaccine of concern. So we have whole new functions in effect that we've had to build out. And then lastly, I'd note we've been enhancing our science and our public health and our medical knowledge. We've hired several hundred epidemiologists and others in the health practices field to reinforce the health voice within the organization.
Yes, thank you. And I know that you're also using other contracted labs, including a lab in Guelph, Ontario, which is my riding. And so really building capacity at a time of a pandemic. The test was going to happen in March 2020 that was scheduled from 2018. And now you're doing it in real time. So I'm actually going to add my compliments to the work that you're doing and for answering the call and answering the challenge to stand up for Canadians. But yes, there are things that we need to improve. And I want to pivot over to the Auditor General, Madam Hogan. I'm concerned about the paragraph 851 in your presentation. It talks about the Public Health Agency of Canada should, in collaboration with provincial and territorial partners, finalize annexes to the multilateral agreement to help ensure that it receives timely, complete, and accurate surveillance information from its partners. In addition, in collaboration with provinces and territories, the agency should set timelines for completing this agreement. Now, those agreements, in another part of your report, it talks about incomplete information coming from provinces, which hindered the progress in terms of interpreting from Public Health Agency of Canada. I wonder about the work of the provincial auditors general and coordinating the next audits so that we can see what in their systems is working and what isn't working, and how we could maybe collaborate on some of the data sharing that's so critical, including vaccine rollout, which as Mr. Stewart just said, is another responsibility, and the concern of not getting vaccines distributed properly throughout provincial territories, which is within their mandate and their constitutionally, but for us to look at that in terms of an audit through the provincial organizations.
The members' questions are always very, very involved. Let me try to answer all of those items. So I'll start maybe with the health surveillance information. And definitely we saw it throughout the audit that there was some difficulty in obtaining timely and complete information. I think we all have to acknowledge that the pandemic complicates matters, and that at times provincial organizations were likely responding and couldn't always provide the information in a needed way, but that information was needed in order to help evolve and alter the response. What we found in some cases, I think it was about only 10% of the cases where symptoms were included on the forms at the early stages of the pandemic, and that really makes it difficult to understand how a virus might be evolving and how a nationwide response should be formulated. So I'll address really quickly collaboration. I'll go really fast.
Really quickly.
Or if you could give it to us in writing. I know I've given you too much on one question. I apologize for that.
I can do it in writing in order to keep us on time. Absolutely.
Thank you very much. Thanks, Madam Chair.
Thank you so much. Thank you so much. We will now go to our next round of questioning, our first round in the second hour, I guess, or starting with Mr. Pierre-Paul Housse for 6 minutes.
Merci, Madame la Présidente.
Thank you, Madam Chair, and thank you to everyone for being here. First of all, for Health Canada, I'd like to hear about controls at airports. We've got a report here from your website, which gives us some alarming figures for 2 weeks from the 1st of April to the 17th of April. There were 117 international flights that came into Canada where there were people who were contaminated by COVID or its variants. And you can evaluate that there's been some hundreds of people involved. So can you explain how we can have 117 flights coming into Canada with people who have been infected where, in fact, they have to show a negative test before they take off?
Mr. Stewart.
Mr. Stewart, please.
Madam Chair, thank you for the question from the member. It is a question of volumes. We've had about 193,000 people come to Canada by air since we established the new border measures. Through our testing, there are 3 tests. As you point out, there's the first test, and it may be that they had a faulty test. It may be that the test was inaccurate. In some instances, which Transport Canada has pursued, it might be that the documents were in fact not accurate. They have the pre-test arrival, and then once they get off the plane, after they've gone through my colleagues at the Border Services Agency, they come to us for a discussion of their quarantine plan, and they go and get tested for the on-arrival test. And the on-arrival test is very important because, as you're pointing out, we're catching people who in fact are COVID positive. And if they're COVID positive, we take a genetic sample from that test and we sequence it in order to determine what they are COVID positive with, what variant it is. And then they go into the quarantine, and in the quarantine, they have their 3rd test. So to your point, some people do arrive, and that's why we have that 2nd and 3rd test, sir.
Well, I'll come back to that in a moment, but I'd also like to look at the report from the 5th to the 17th of April. Many flights coming from Delhi in India coming in with Air India, so that raises a flag for me. Is Air India actually asking passengers to provide a test, or is it possible that the airline is not respecting our rules and regulations? Do you have a quick answer on that, please?
Well, the question about whether Air India is responding to the rules and so on would probably be better put to my colleagues at Transport Canada, who are responsible for that aspect for it. But it may also be that there are problems with the testing or the standards testing, and we are in fact investigating to see that we're getting the right testing standards being used.
Okay.
Okay, so I'll come back to what you said about the tests. So certain countries or certain airlines are perhaps not doing their work. That's one thing. But when we come to Canada, the passengers that are detected, for example, with an Air India flight came in and there were contaminations for 3 rows. So then the passengers are detected upon arrival. And if that's the case, what do you do with them? Are they put into isolation? Because we're trying to understand why. Well, the government is saying that we've got the best control system in the world. We're the best everywhere across the board. But we're seeing that the variants are coming into Canada from all different countries. There must be a reason why we're not able to control this. If we're so good, once we detect that people have been infected, what do we do with them? What's the procedure?
People who test positive, if they're highly symptomatic, we bring to the to medical health. They have to go under healthcare. They're very ill. If they're asymptomatic, they go into our designated quarantine facilities that we run, which are intended to hold people who may well be infectious. And so, to answer your question, sir, they're held. They either end up being in medical care or they end up being in a quarantine facility intended to ensure that they don't infect others.
Okay. Puis là, là-dessus, j'aimerais savoir.
And then I'd like to know, in terms of checks and controls, we've heard from witnesses that was a problem with the control of passengers. Some don't listen to instructions and try to leave themselves. So do you have strong measures, because the Border Services Agency doesn't have the power to detain people, but with the Quarantine Act, you have that power to have controls at airports where we can intercept people and oblige them to stay if they're infected? Or are there some who decide to leave themselves and ignore the problems?
Madam Chair, to the Minister's question, when we were presented with non-compliance at the get-go, we took a decision that we would fine them. Under our act, under the Quarantine Act, we have the ability to fine them. The public health agency is a public health agency. We don't have a coercive force. We're public health professionals, and so we use fines. And as of this moment in time, or as of yesterday, we had issued 964 fines had been issued for people who have not complied with one aspect or another of the regime that we're discussing at this moment.
Thank you very much, Mr. Paul Hughes. You have 8 seconds left. I think we will move on to Mr. Sorbera for 6 minutes.
Thank you, Chair, and good morning to everyone. Good morning to my colleagues, and good morning to all witnesses. A lot has been discussed today, and I thank everyone for this question. So I'll try to be as succinct as possible. Firstly, to the Auditor General, thank you for you and your team in all sincerity for your work. I did a deep dive on this report in the last couple of days on pandemic preparedness, surveillance, and border control measures, and it is very thorough. I expect that from an Auditor General and her team and their team. At the same time, there's a lot of really good recommendations. If I can just speak to the border measures, it's page 28, section 8.86, in terms of the findings with regards to CBSA and CBSA's ability to quickly enforce emergency orders prohibiting the entry of foreign nationals, which was obviously something that the government put in place. But at the same time, the Public Health Agency and CBSA's ability to disseminate the pertinent information to the frontline officers in terms of the exemptions or non-exemptions. Can you comment on that for essential workers? Because it is something we've had to deal with here at the constituency office several times, businesses and organizations needing essential workers to come to Canada, and how that iterative process has happened.
Well, thank you for the question, and thank you for your nice comments about our work. I am very proud of all the work that we do, and it's always nice to hear some nice feedback. So thank you. What we saw at the border was that the Canada Border Service Agency collaborated very well with the Public Health Agency of Canada in order to develop guidance for border service officers to use. As you can imagine, with the evolution of the pandemic, the requirements and the orders about what the restrictions would be, who would be allowed entry into Canada were evolving. And hence a lot of judgment was needed to be used by border service officers. What we found is that there was a need for a better follow-up to see that those exemptions were being applied consistently, and hence why our recommendations to provide more detailed guidance, some training, and a better follow-up on the consistent application of restrictions. Anytime judgment's involved, there's going to be differences, and we're going to hear about individuals who believe they weren't treated fairly, but we have to recognize that it was an evolving situation, and that's why we thought some more oversight was likely a good solution as this continues to evolve.
Thank you to the Auditor General. In this world we live in, there's some commentators, and I remember reading a book many years ago called The Black Swan, where an event happens and it's a black swan. You go to a lagoon and usually you just see white swans, but the book's title is Black Swan. And when the event happens, then we look back and we think, oh, we should have been able to predict that event. And specifically, that book came in reference to after the events of 9/11, and that the event should have been predictable. We should have been prepared, but no one actually predicted the event that is an event would happen. And here we have an event once in a 100-year event, global pandemic that no one was speaking to, referencing, or even in a lot of countries prepared for. In terms of to the folks over at the Public Health Agency of Canada, from where we were pre-pandemic to where we are now, in terms of resources, IT structure, and the ability to communicate with our provincial partners. Can you please comment on that? I know it's a big holistic question, but I do want to understand where we are now.
Well, I think we're in a significantly different place, whether it's the scale of human resources or financial resources. Think about what's been done securing personal protective equipment and stockpiling what's been done with respect to securing vaccines, and this will be a multi-year pandemic. So we have an inventory of vaccines and people now who can handle and administer them. And think about the border. The border is in effect a perimeter of knowledge now about what's going across, and we can identify what issues it raises. So there's a lot of infrastructure and skills and talent that have been brought to bear, Madam Chair, to your question, honourable member. And I think we actually have a substantial improvement at many levels, to be honest. The question will be, as the pandemic evolves, how does our organization need to continue to evolve to respond to it? So we're kind of in the middle of responding to the needs of the day, and they will continue to change, and so we must continue to change too. I hope that answers your question, sir.
It does in terms of directionally, because the way I look at things, it's not just about adding human capital to an issue. It's about adding the right resources to an issue. And you can hire on 10,000 people, but the outcome may not change unless the organizational structure, the goals and methodology in place are pertinent to the issue at hand and the problem, and right strategy is identified. That's my humble opinion. We need government to be efficient and effective and protect Canadians. Unfortunately, 23,000 and counting Canadians have passed away from this pandemic, and we know we all need to do better, and we all need to be better prepared in that light, and that goes to all levels of government, of course.
Thank you very much, Mr. Sorbara.
Thank you, Chair. No, that's totally correct. Thank you.
You're welcome. Thank you. We will now move on to Mr. Blanchette-Joncan for 6 minutes.
Merci, Madame la Présidente.
Thank you, Madam Chair. I have a simple question. Mr. Stewart, I understand that the source of the problem afflicting your organization was also there at the beginning of the pandemic and in previous years. So the reduction of financial support from various governments over the last decade, has that actually undermined the ability to intervene and respond and to be fully prepared to react to the pandemic?
Madam Chair and member, thank you for the question. A very interesting thing to think about is what your question implies, which is in a pandemic, it's evident how much capacity and scale and competencies are required. And in a way, the previous question was getting at that. What's harder is during the periods prior to, and at that time, imperatives like balancing the books and being responsible and prudent and so on come to bear. And so a very interesting challenge for the Public Health Agency going forward is how do we evolve ourselves to recognize it's an accordion kind of function where there will be moments of great stress and need, and then we'll have to sustain things over the longer term. And I think your question touches on that. Prior to the pandemic, the scale of the operations required needs to be planned. And I think that's the Auditor General's point around the planning and planning exercises. It needs to be better planned and better understood, this scaling up of capacity that's required. And as we go forward, we need to keep memory of that as a community about what is the level of what's required for the next pandemic. Thank you for your question, sir.
Thank you, Mr. Stewart. So basically, you didn't have enough money to be prepared to face the pandemic?
Well, those are always questions which are difficult to answer. I think what we can say with absolute hindsight is...
Stewart,
sorry.
Well, Mr. Stewart, you've said that with the autumn economic snapshot, there was additional money to help you. So I'm trying to understand your logic. Do you not have enough money, or are you satisfied with these new monies that have come in? And what are you going to do with the new money if you're saying that it wasn't missing before the pandemic?
Substantial money has been provided, Madam Chair. If you look at the public accounts for the Public Health Agency of Canada, we received a lot of additional resources to help us buy vaccines, personal protective equipment, and so on. And yes, we did receive operating resources to increase the scale of our staff as well. So I think that kind of indicates the level of resources required for this moment in time.
Perfect. Just Stewart.
Perfect. So the 20th of April, just after historic budget, several billions of investment in PHAC is something still missing for you to get through this pandemic.
Where we have needed resources, they have been provided. Going back to my overall theme, Madam Chair, about the fact that the pandemic evolves and the needs evolve, my experience has been since I started on September 28th, if there's a thing that we need, people support us.
Merci de répondre à la question.
Thank you for that response. And I'm going to turn to the CBSA, Mr. Osowski. So as of March 2020, there was enormous pressure to repatriate Canadian citizens back from abroad. There were certain countries that closed their borders and their airports. It made it very complicated. And as time went on, we were late in closing our borders. We were like a real sieve. So I tried to understand how after the event you can actually evaluate the consequences of these delays.
Well, thank you for the question, Madam Chair. So I would say from the outset, the government worked closely with our public health advisors, both provincially and federally, to respond to the threat of the virus. It was evidence-based and based on scientific advice. And so it was done in a very stepwise kind of manner. We started with our first screening measure, if I recall, January 22nd, screening travelers who had come from Wuhan region, and it's progressed through 47 different orders in council to date as we've adjusted to the changing requirements on the ground. So we had a good plan in place. We've had a pandemic plan at the agency since 2012, and we've updated it and exercised it. And so I'm grateful for the Auditor General's comments about how well we responded.
Merci, Monsieur Osowski.
Thank you very much. Do you think that the decisions that came from above were communicated too late? I'm trying to understand. Earlier, I asked Mr. Stewart whether PHAC had made recommendations to totally ban non-essential travel, and his answer was no. So I'm trying to understand. We've got people who have travelled abroad, but when we bring them back into Canada, of course, we try and target these people to make sure that they're placed in quarantine, but we haven't met these targets. So we brought people back, but we know that they will not be able to comply with quarantine. So limiting non-essential travel, would that really help you in your work to ensure there'd be less people who would have come in? So the Quarantine Act, would you then be able to make people really comply with it more?
Very short answer, please.
So we did ban non-essential travel, but I would just say that Canadians have a right of entry to Canada. So if you're coming back, we have to respect your charter rights and mobility rights. And so even though we banned foreign nationals for non-essential travel, certainly Canadians all over the world had a right of entry.
Thank you very much. We will now go on to Mr. Bachrach for 6 minutes.
Thank you, Madam Chair. And I'd like to pick up where I left off discussing the rapid risk assessments. Mr. Stewart, in your response, you indicated that with the rapid risk assessments, the Public Health Agency of Canada was essentially experimenting, your words, with an unproven methodology. And I think when we read Ms. Hogan's report, we can see very clearly that that experiment failed. My question is, did the failure of that experiment cost Canadian lives?
It's in the Auditor General's report that we tried to use these methodologies. So it's a matter of public record. Overall, there's been a loss of Canadian lives arising from the pandemic, which, as previously been mentioned, Madam Chair, is of course a tragedy and unacceptable to all of us. I think it would be difficult to know the connection that you're proposing, sir. But we do note the importance of ensuring our efforts are better and that we're making a more constructive and positive impact in fighting the pandemic.
Mr. Stewart, paragraph 8.62 in the Auditor General's report states that quote, we found that for more than 10 years prior to the COVID-19 pandemic, the agency had identified gaps in its existing infrastructure, but had not implemented solutions to improve it. In its last 2 strategic plans for surveillance, the agency identified several capacity deficiencies in the information technology infrastructure used to support its public health surveillance activities. How could this be allowed to happen? Did PHAC underestimate the importance of addressing these deficiencies?
Madam Chair and Honourable Member, thank you for the questions. The infrastructure being referred to is IT infrastructure. A lot of effort has been done to address and remediate the issues that were raised by the Auditor General, and more work is proposed. I mentioned earlier that in fact new resources and a new unit has been created in that exact area. We've been working closely with the provinces and have a shared plan about how we're going to approach data, which touches on infrastructure like our data portal. We have an outreach and a consultation agenda to try and identify how to improve it. So we take it very seriously, and we do see it, as you're suggesting, as an area for improvement.
So I appreciate, Mr. Stewart, that a lot of work is currently being done. Obviously, knowing the impact of the pandemic and the severity of things, but this is something that goes back 10 years. So in the 10 years between when it was first identified, this information infrastructure gap, and the Auditor General's report, what actions did PHAC take to resolve those deficiencies that were identified?
Maybe, Madam Chair, I could say 2 things. One, first of all, I'd say I'd be happy to come back to you in writing with a narrative on the 10 years with respect to infrastructure investments and activity done, because I think that that might be the kind of thing you're looking for that just very squarely responds to your question. Secondly, I would just point out that IT infrastructure is a boundless frontier. In my last job at the National Research Council, we were forever trying to keep ourselves current and in fact at the leading edge of IT infrastructure. And so for a public health agency, that's true as well. May I come back to you with a chronology in that regard?
Sure, that's fine. Maybe I could just ask one follow-up question. Was additional funding ever requested in budget submissions to address those gaps over that 10-year period? And were those budget submissions approved?
We'll come back to you on that regard, sir.
Okay.
Thank you very much.
Thank you. Perhaps turning to Ms. Hogan. Ms. Hogan, you've referenced a 2009 report by the Auditor General's Office related to pandemic preparedness. Did the Public Health Agency of Canada also accept all recommendations from that report?
I think in one of my previous comments, I referenced a 1999, a 2002, and a 2008 Auditor General report related to, just in case you're going to go look for them. It is my understanding that in all of those cases, our recommendations were agreed to and actions expected to be taken.
And were the actions that were committed to followed through on? Were the recommendations implemented from those reports?
Well, what we saw in 2002, not everything from 1999 had been addressed and so on. And what we're finding now is the same thing, right? Is that there is actions taken in some areas, but just not completely. As we identified in the current audit, some key areas like coming to a mutual understanding with federal, provincial, and territorial health agencies about the kind of information to be shared, how it should be shared, and when it should be shared, we're not taken care of.
So, Mr. Stewart, given that there are these reports that Ms. Hogan has indicated, and given that your agency accepted all the recommendations in all of those reports, and yet those recommendations weren't implemented, what I heard you say in your opening comments was that you accepted these recommendations and they were going to be implemented. Why should the Canadian public trust that this time is different?
A very short answer, Mr. Stewart.
Well, we've set out in our response to the Auditor General the plans that we intend to undertake, Madam Chair, and to the Honourable Member's question, we will be responding as we set out in those documents. There are other times and events where not all recommendations are able to be addressed specifically. We can explore, in that chronology, what we've been missing.
Thank you very much. We will now move to our last round of questioning, starting with Mr. Paul Hoos for 5 minutes.
Merci, Madame la Présidente.
Thank you, Madam Chair. So I'd come back to Mr. Stewart to continue with my line of questioning from earlier about passenger arrivals in airports. Last week, we put questions to the House of Commons about flights coming in from Brazil. We know that the Brazilian variant is a very aggressive variant. And we heard that there were specific tests that had been cancelled. So as president of PHAC, can you explain why we've reduced these tests, even when we know there's this enormous danger?
Madam Chair and honourable member, we, as I was outlining earlier, set out a perimeter that now involves 3 tests, one before arrival, one on arrival, one 10 days into quarantine. And the government approved accommodations for the first test done here in Canada and genetic sequencing, et cetera. That perimeter is extensive and applies to every single non-exempt traveler arriving in Canada. And that applies whether you're coming from Brazil or coming from pick your country of choice. And so that applies to people arriving from Brazil as well. It's extremely comprehensive.
Okay. Mais il n'y a pas un test.
But is there not a more specific test for Brazil, given the Brazilian variant, or is it the same general test that's administered, or is the one for the African variant, the UK variant, and then the Brazilian variant? We know there's specific tests that have been stopped. Is that the case or not?
No, sorry, Madam Chair, no tests have been stopped. We're doing 3 tests for every non-exempt traveler who gets off an airplane, and they're genetically sequenced. It's important to note it's the same testing technology identifying the original virus or the variants. It works for them. And what we genetically sequence for is to identify which variant it was. So there's been no reduction in testing at all. It applies to everybody arriving who's a non-exempt traveler. And consistent, and therefore it includes Brazil.
So now to come back to the travellers. I talked earlier about travellers who don't accept to put themselves in quarantine. We've heard there's 964 fines. Is that the correct number? So we've got 964 people who've been identified, because you've talked about volume. You've said there's high volumes coming into Canada. Even if the border is apparently closed, we've got thousands of people still coming in. But is that information correct? It's only 964 people. It's still 964 people too many who are not respecting the guidelines.
Well, so Madam Chair, I don't know what the right number would be of the tickets. We have 942 tickets that we have issued under the Quarantine Act, and then we have 22 additional tickets that were issued by under municipal orders, and the total is 964. So those are the facts, as it were, sir.
Merci. Madame Hogan.
Thank you. Ms. Hogan, I've got a question for you. On page 39 of your report, there's a nice table that explains your audits about people who've been asked to put themselves in quarantine, and there's 46% who didn't respect the quarantine. So on that, I'm also trying to understand whether you've verified this, because in Quebec, some weeks ago, Quebec Public Safety said that they weren't informed. They didn't know that passengers that were coming to Montreal or arriving in Toronto that were coming to Quebec, they didn't have any information between Public Safety Canada and Public Safety Quebec to carry out the follow-up. So in Quebec, it's Sûreté Quebec, it's not the RCMP that's involved. So that means that all the passengers that came into Quebec, there was nobody who could actually carry any checks on them. Is that correct?
Dans le tableau.
Well, in this table, we take note of the fact that when an individual has been identified as at a high risk of not complying with the quarantine rules, then the agency decided that in 46% of the cases, they refer to them to the enforcement police services. Now, we haven't had a breakdown by provinces to see if this has been done, but we saw that there was around only 40% that we'd asked enforcement to step in. But my question is basically, at the moment, when passengers are coming into Canada, in Quebec, there were no checks by the police services, so we couldn't actually survey or check what was happening with anyone. Well, I think we have to answer quickly because time has run out. I would just like to say that the officials at the border decide whether someone can come in or not, and then they're referred to the agency. Yeah, there's a follow-up to carry out a checkup on the ground, but there was no checkup on the ground, basically.
Thank you very much, Mr. Paul Hoos. Our last questioner will be Mr. Fergus for 5 minutes.
Merci beaucoup, Madame.
Thank you, Madam Chair. And I'd also like to thank our witnesses for appearing before us today. I have a similar question that I'd like to put to each of the agencies and also to the Auditor General. I'll start with Mr. Osowski. I'd like to know, now we're at the 20th of April, 2021, with 13, almost 14 months into the pandemic. And you've got the Auditor General's report. You agree with all of her recommendations, and I imagine that you're going to implement all of this. If you implement all of these recommendations, are you now convinced that you are prepared for the next pandemic?
Thank you for the question. Well, I'm pleased to report that we actually have implemented almost all of the recommendations in terms of the measures that we'd put in place. The one outstanding one is an additional training tool for officers. Those would be the ones in our college and our training college, so the new recruits, just to familiarize them with the order and council regime. So in terms of the feedback loop, providing more clarity, adjusting regularly, we have a very robust action plan that, as I say, has almost been completed.
Merci.
Thank you very much, Mr. Osowski. And I turn to Mr. Stewart. Are you now prepared? Is the agency ready for the next pandemic?
I think the agency is equipped and able to respond to the needs of the current pandemic. The next pandemic may take a different form, to be honest, and that's part of the planning and discussing that we need to do as per the Auditor General's report. I'll give you an example. We've been talking about quarantine. The Auditor General in her report pointed out that there was insufficient follow-up to make sure people were in quarantine. Since that time the Auditor General looked at, which ended in June, we actually have hired 4 national security companies who now do that function with the Sûreté de Québec and the RCMP or the local public health authorities. And just for the record, we have done 179,953 door knocks following up on people in quarantine to make sure that they actually are where they're supposed to be. So part of the problem with the Auditor General's report is looking at a period where we were launching, building, and so on. And so now to your question, Madam Chair, to the question, we have built capacities that are enabling us to do the things we're trying to do now. And to the Auditor General's report, we have to continue to improve our planning ability with respect to your question about are we ready for the next one?
Madame Hogan.
Ms. Hogan, continuing on from the responses from the 2 witnesses today and the role that you play to provide the Canadian population with the evidence, are you convinced that these 2 agencies are now on the right path to react to the next pandemic, the next crisis? Well, no audit can give you absolute certainty. No, I'm not looking for absolute certainty. Well, I'm convinced of the goodwill of the agencies and the good intentions of these officials to take up this call for action to support Canadians. if the agencies address our recommendations, then we'll be on the right path to being better prepared. But when you're going to be well prepared, you need to be flexible, because as another witness has already mentioned, the next pandemic will be different from this one that we're experiencing currently. So we need to be ready to go and find the necessary capacity and have plans with clearly defined roles and responsibilities so that the response can be quicker and more coordinated next time round. Thank you very much, Madam Chair. I think that it's almost the end of my time limit for putting questions.
Thank you very much, Mr. Fergus. You are correct, and those were great questions to end our time on. Witnesses, I'd like to thank you for joining us and invite you to take your leave at this time. Thank you very much, colleagues. It looks like our witnesses have all left. I just actually wanted to take a couple of minutes to discuss some future business so that we can provide direction to our clerk and the analysts for scheduling our meetings in May. You should have all received the list of the remaining reports from the Auditor General that we may study, as well as a proposed calendar. I guess what I would do now is just ask if anyone has any questions or comments about the proposed calendar that you have before you. I know that we've had, Mr. Longfield.
Yeah, we sure have a lot of studies, and I'm wondering about the time to review the reports that we're sending back. We're really front loading our schedule here.
That's a very good question, and I will ask our Dylan to perhaps respond, because we did have this very conversation.
Thank you, Madam Chair. To the member's question, so as the chair respected, we have a chair's meeting last week, and we talked about some of the sort of scenarios. And the issue is that, so we have the 9 reports that have been tabled recently, and then the Auditor General will be tabling 2 more. The issue is that, you know, do we want to, for example, study all 11 reports, which means we won't be able to do draft reports for all of them in this current session by the end of June. The thinking was, and of course it's up to the members to agree, that it might be easier if we review a draft report for something that was studied within the same month. So perhaps it might be easier for the members that if we were to study the 2 reports that are soon to be tabled in the fall, and then when the draft reports are made available, that'll be closer in mind and memory on some of those key issues. I hope, Madam Chair, if that's what addressed your question.
I believe so, Mr. Longfield.
Yeah, I mean, I love the idea that we're coming back in the fall. Of course, we never know what might happen in the House. I wonder about maybe doing some draft reports after. I think maybe what you were saying, Dylan, was at the end of the month, we could have a month-end meeting where we look at draft reports.
Absolutely. We have budgeted time to, and Andre can, you can add in on this, but we, the analysts with the clerk together, have budgeted enough time to study the 9 reports, and very likely have 9 draft reports, at least 8, but possibly 9 draft reports ready by the end, the middle to end of June. Have all of them heard, hearings, translations, notes, etc., and ready. And draft reports, yes, for approval of the committee.
Does that answer your question, Mr. Longfield?
It's certainly aggressive. I'm just thinking of how what kind of shape our brains will be in when we're going through the 8th, 9th, 10th, and 11th report, and whether maybe we could break it up a little bit more to have us review 4 reports at a time. And
Pardon me, Madam Chair and Mr. Longfield, I guess I wasn't clear. No, it would not be all 9 at once. We plan on doing a couple in about a month or so, and then there'll be more hearings. It's like a daisy chain of hearings, draft reports, hearings, draft reports, like that. Certainly, we would not task members with having to do that many in one day. Mr. Sorensen's time, they did undertake 7 in one day, but that's a that's not a favorable position. No, sir. It's and ma'am and everybody in the room. C'est-à-dire, c'est vraiment notre plan.
So our plan is really to have a certain number of meetings and then follow that up with some draft reports, then again certain meetings, and once again some draft reports coming through. So it's this chain of progress, if you like, the daisy chain approach.
If I could just get some clarification, since I'll be contacting the witnesses, because if we look at the calendar, we had basically scheduled meetings on reports from now until May 13th, which would do all of the reports that are presently referred to the committee, and then start doing draft reports on after the break week in May. So if I understand Dylan correctly, he's thinking of maybe doing some draft reports before in the first weeks of May, and I just want clarity so I can contact the witnesses to give them dates.
Si je peux me permettre, Madame.
Yes.
Madame la Présidente.
If I could please intervene. So what we were planning was to have a first meeting the 26th of May after the break week with 3 reports on the CERB and today's report on preparedness for the pandemic, and also on the wage subsidy, emergency wage subsidy. And then probably in the 1st of June, we could have 3 other reports. And then the next week, on the 8th of June, we could have another 3 reports. So that's our plan for the moment.
I see Mr. Longfield giving us a thumbs up. Mr. Fergus.
Je suis 100% d'accord.
I'm 100% in agreement with this daisy chain approach that's been proposed, but I feel kind of guilty vis-a-vis our analysts and all the work that they'll have to do, all the hours they'll have to put in for the next 10 weeks. So upstream, I'd like to congratulate them and thank them in advance and really acknowledge their hard work. Thank you. Thank you very much, sir.
Thank you, Mr. Fergus. Mr. Sorbera.
Oh, excusez-moi, Madame Chair. Je veux dire la même.
Sorry, I just wanted to say the same thing as my colleague has just expressed, Mr. Fergus.
Alice, pour tout ton travail.
Thank you for all your work. Thank you.
Thank you very much, Mr. Sorbera. So colleagues, are you ready to adopt the work calendar as proposed? Mr. Blanchette-Jonca?
Madame la Présidente.
Thank you, Madam Chair. I just have a simple question for our analysts, because I'm just trying to look at the planning and know that the OAG had to respond to a motion on the emergency measures that was passed by the House before the 1st of June so that we could have a report on the findings. So are our analysts expecting that there will be other reports on COVID before the 1st of June? I know they can't speak on behalf of the OAG, but should they reserve some time for that as well, perhaps?
Thank you, Mr. Blanchette-Jonca. I know that we also talked about future reports, so I'll turn it over to Andre.
Oui.
Yes, thank you. Yes, the Auditor General has already indicated that she wanted to submit 2 reports at the end of the month of May. I don't know if there's an official date for that yet. But yes, that's been fully taken account of in our timetable, our proposed deadlines. So we think that towards the end of May that there would be this submission from the Auditor General. And then we'd still have enough meetings to be able to study the draft reports and also perhaps study the next two reports once they've been submitted. We don't know exactly what they're going to deal with yet. But for the last two reports that are to be submitted at the end of May, it's possible, very possible, that we might not be able to produce a report on this subject ourselves because we just won't have enough time to do that.
Thank you very much, Andre. Colleagues, in answer to the question regarding adopting the work calendar as proposed, I saw thumbs up from most of you, if not all of you. Just a reminder that Thursday's meeting will be on Report 7, Canada Emergency Wage Subsidy. And is it now the committee's will to adjourn the meeting? Thank you very much. We are adjourned. Have a great day.